This is Dr. Jamie Antoine from the Minnesota Disc Institute. In this section, I'd like to briefly explain what a bulging disc is. And to really understand a bulging disc, you need to have just a little bit of understanding of what normal disc anatomy looks like. So very quickly, when we look at a nice healthy disc and we look at a vertebrae, this is what we want to see. This, of course, is the bone or the vertebrae, the spine. This, of course, is the nerve, and this is the disc. And when we look at a nice healthy disc tissue, we want to see that the disc is nice and big and thick. There's no compression on that disc. We also want to see that the inside jelly-like fluid that's called the nucleus, that's contained by the outside annulus. So that represents a nice, healthy, normal disc. And when we look at an MRI, it's also very easy to see what a normal disc looks like. So this is a great example here. And very briefly, we see the vertebrae or the bone, the spine. We also see the spinal cord, and then of course we see that the disc tissue is here. And on a nice healthy disc, again, we'll see nice good spacing, and most important is that the disc is white. That whiteness represents a healthy tissue. And we can also very easily see the beginnings of a bulging disc. And you look at this example here, you see that disc is pushing out on the spinal cord. That of course is going to cause pain, numbness, tingling, weakness are very common symptoms of that issue. But most importantly, we see how that disc is becoming less white than the other discs. And that's a very important distinction that we need to cover very quickly. You must think of the disc kind of like a plant or a tree, something to that effect, that's not getting water that it needs. If you stop watering a plant, eventually green leaves will turn brown, for example. And it's very important to understand that you cannot have a brown leaf unless you have a bigger water issue, of course, which would of course be the problem. And it's really the same concept when we look at that example again. You cannot have a bulging disc unless there's a bigger issue happening. So the bulging disc is really the condition, while there certainly is a problem that's allowing that to happen in the first place. And really the great news for the appropriate candidate, someone that goes through our process of getting tested and examination and reviewing the MRI, if we qualify somebody for our care, we actually have over a 95% success rate in helping that patient eliminate or substantially reduce their pain and really ultimately avoid surgery. If you'd like more information about that or to see myself for a consultation, feel free to call our office at 952-500-8090. Thank you.